Welcome back to the morning show here on Arise News. The message of the 2019 World Population Day seeks to reinvigorate the conversation about reproductive health. With the population of the world pushing towards the 8 billion mark, the United Nations has continued to show consistency in its support and advocacy for a virile human race. Joining us now for a closer scrutiny of this subject is Dr. Ben Odusanya, a medical doctor whose area of specialization focuses on surgical and medical diseases of the male and female urinary tract system and the male reproductive organs. Welcome to the program, Doctor.
Welcome to the program, Doctor.
Thank you very much, Tundu.
Well, when you were introduced before you arrived, we talked about urology, right?
Yes,
I mean,
sir.
to the average person out there, many of our viewers may not know what urology is all about. Some people will think it's just erectile dysfunction or that it is about a prostate. Please, can you enlighten us what this big subject about, reproductive health organs, is all about?
All right. Urology is that aspect of medicine that deals with diseases of the urinary and the genital system, both in men and in women. Majority of our patients may just end up being men, but it does not mean there are so many divisions of urology. For example, you have endourology, which deals with stones of the urinary tract, with prostate diseases. You have reconstructive urology, which deals with things like incontinence, urethral stricture. You also have oncology, which deals with cancers of the kidneys, cancers of the ureter, the bladder, the prostate, and the urethra. And you also have other aspects, such as neurourology, which deals with the functional aspects. That means how the nerves control the function of the urinary tract.
So a lot of men are reported to die of embarrassment, literally, because they notice symptoms, but they're too embarrassed to actually seek help. What are some of the easy solutions that exist so that you can reassure our male viewers that they should come in and seek the services of a urologist like yourself? What are some of the symptoms that should really be a warning sign that you really do need to suppress that embarrassment and go and see a professional?
The first thing is to tell people that weak erection, which in medical parlance we refer to as erectile dysfunction, is really quite common. There was a study done in the United States, the Massachusetts male aging study, realized that everybody ranging from 40 up to 70 years, there were different incidences of weak erection occurring, but the incidence increases as men grow older. But unfortunately, except the doctor asks the men directly, most times the men don't like to complain about it. But so what has been the conclusion of that is that doctors have been advised to ask men directly, especially when they visit their family physician or their primary care physician for a routine health check, for them to ask directly, are you having any problem with your erection? Then the man will actually open up and voice out that, yes, I may be having some problem. More importantly, the outcome of the Princeton's criteria of Princeton's committee, there was a study that shows that weak erection is strongly associated with cardiovascular disease. So it's not just a matter of your penis not working, your life may literally depend on it, because men that are noticed to have weak erection have higher incidences of heart attack and strokes and peripheral vascular disease. That means that the blood supply to the limbs is not working as well.
What are the treatment options for a weak erection?
There are so many treatment options. Now, it is important to classify it. There are some that is due to psychogenic. That means that is due to, has to do with your thought patterns and processes. Those ones will go for counseling. But the ones that are organic, that means that there is something really wrong with them. I won't go into further classification, but you have oral treatments, you have topical treatments, you have injectables, and you have artificial implants that can be used.
Well, this erectile dysfunction, maybe we'll stay on it a little bit, or what some other people call impotence. I mean, you are a Nigerian, you are a man yourself, and you know that it's of very serious interest, not just to men, but also to women, And most Nigerian men, the method they adopt is to take herbal drinks, Alomo, Origin. Some say if you take a bottle of stout, you will be fine. Some take alcohol. There are all kinds of things out there that they use, in dealing with it. Do you think that that is wise, or the best option is to see a medical doctor You know, if you are Yoruba, you must also know about these herbal concoctions. You know, that is supposed to, you know, make a difference.
Yes.
You know.
While it may be true that there may be some active components in herbal medicine, one of the problems with herbal medicine, what we in medical world called posology. What is the dose? There is no regulation of dose. Nobody knows whether you should take 1 cup or you should take a whole bottle. And the other effect is side effects. This man has not been followed up for side effects. That is why, as much as possible, we don't advocate herbal concoction. Obviously, I'm not a herbalist. But the drugs that the Western medicine prescribe have been tested, one for dosage and also been tested also for side effects. So, and the other thing I alluded to earlier is that a man having an erection is an opportunity to pick up cardiovascular diseases. Erectile dysfunction is highly associated with hypertension, diabetes, hyperlipidemia. That means if you have too much oil in your blood. And all these are risk factors for men having myocardial infarction. Let me just explain what I mean. The blood, the pipe carrying blood to the penis, that's what we call blood vessels, are about 2 millimeters. That means they are very small. The one carrying blood to the heart is about 5 millimeters. So which one will get blocked first? Obviously, the one gets supplying blood to the penis. Now, that weak erection may be a harbinger of a possible heart attack in future, in the next 4 to 5 years. But if the man does not go for a proper evaluation, because the advantage of seeing a doctor is that you may have your BP check, you have your weight check, you have your BMI calculated, they check your blood sugar, they check your blood lipids, and they also check your hormones. These are all things that can contribute to weak erection. Let me not even tell you that even some of the Western medicine will not work if you have not been properly evaluated. I've seen men that have taken all kinds of tablets, but until they were evaluated, realized that, oh, they actually have a low testosterone. There's a syndrome called Adams syndrome, that is androgen deficiency in the aging male. As men grow older, some of them develop shrinkage of their testes, which we call atrophy, and then the testis doesn't really function well, produce enough testosterone. Without testosterone, you won't get enough, or the rigidity of the erection will not be good enough, no matter what you use. And these are some of the things that will frustrate people seeking care in the treatment of erectile dysfunction. But that's why we advocate go to a doctor and get help, and make sure that they actually at least check your blood sugar, check your blood pressure. It's an opportunity to pick other more life-threatening diseases.
And beyond erectile dysfunction, sperm count also seems to be an issue in a lot of Nigerian men. I recall an interview that I had last year with a doctor that's gone into research, whereby he stated that today, 1 in 8 Nigerian men don't have sperm. And in the majority of cases where couples can't have children, and of course based on the society and the way society stigmatizes women for certain things, the woman is blamed for what is usually actually in Nigeria, being a case study, the man's fault based on our statistics. How true is this? And what is causing the low sperm count, in Nigerian men?
What I would say about infertility, that is the inability of a couple to achieve pregnancy after 1 year of unprotected intercourse. The causes is 50% female, 30% shared between male and female, and 20% only male. So to blame the woman for inability to have a child is just ignorance. Now, the fact that the sperm count is reducing may be related to, this is not fixed, because nobody has actually done local studies to prove it. May be related to more exposure to environmental toxins. You are aware that most of us now, we use a lot of generator, we go through a lot of traffic, we're exposed to a lot of air pollution, some of our food, even the plastic in the oceans, and even some animals, the production of cattle, some of them are exposed to estrogens. There are so many theories about why men are developing reduced sperm count. The exposure to pesticides, what happened is that the farmers use the pesticides to kill the weeds. The cow inadvertently taking the pesticide, which gets stored in their meat, we consume the meat. Also, if you look at mercury and all kinds of toxic dumps in the ocean, we think we are just dumping our waste in the ocean. The fish eats the food from the ocean. We eat the fish, ends up in our body. Some toxins are not easily eliminated because most of these molecules, let me use that word, most of these substances are not natural substances. They are artificially created. They are synthesized in the lab. So the body cannot break them down easily. So this may be some of the reasons why men develop low sperm count. There are, however, congenital reasons. In science and medicine, when we look at causes of anything, we look at, were you born with it or did you acquire it? There are some conditions that are congenital. Part of it, if you have people with chromosomal anomaly, there's a condition called Y chromosome microdeletion. The Y chromosome is the male chromosome. If there are some critical errors in that chromosome, the man may turn out to be azoospermic.
So quickly, let's talk about prostate, which is also something that is talked about a lot, among Nigerian men in particular. What conditions predispose, a man to prostate? And is it only just a male problem?
The truth is that prostate disease is strictly a male problem.
Okay.
Because ideally, only men, or in reality, only men have prostate.
Yeah.
Now, what makes a man to have prostate disease is age. That's the first thing I must mention. It is more common the older you get, the more likely that you will develop. It's not fixed in stone, but by the time you're getting to 50, 60, 70, a lot of men come down. Between 3 to 5 men will come down. And by 80, majority we have prostate enlargement. However, because a man has prostate enlargement does not mean that it will be symptomatic. That's the error we as specialists are seeing. A lot of people get sent to us, so the prostate is enlarged. We tell them, so what? Is it symptomatic? Is he having any symptoms? So about 10% of these men, we actually come down with symptoms and we actually need treatment. Apart from age, obesity has also been alluded. Presence of diabetes mellitus has also been alluded to, things that can make you develop. Also, family history. We typically ask men that come to us, does your father have it? What about your uncles? We always ask about your male relations because we know that these things run in family. Actually, there is a gene called hereditary prostate cancer gene. It's on chromosome 1. So these are some of the things that we ask people, oh, do you have a family history of it? Also, it is important to note that the Africans are more predisposed to have more aggressive form of prostate cancer or prostate diseases. There are several reasons postulated for that.
But before we go, very quickly, can you tell us what are the treatment options, or is there a cure for male infertility?
It depends on etiology. Like everything in medicine, the first thing we ask is, what is the cause? If you cannot find the cause, then you cannot treat it. Up to 1/3 of male infertility are idiopathic, up to 1/3. But the good news is that as long as the patient is not azoospermic, most of them may be amenable to assisted reproductive technique, whether in vitro fertilization or intracytoplasmic sperm injection. A very common treatable cause of male infertility is varicocele. When dilated vessels allow excess blood and the temperature goes up. It has been found that it's more common in men that have infertility. Another cause I must mention that is preventable, however, that I must mention is testicular torsion. That is when the testis twists and dies. Any male having severe pain, excruciating pain in his testis for more than 4 to 6 hours is at risk of, may actually be having testicular torsion, and that needs to be sorted out. That needs to be sorted out. The other treatment option is for people that are azoospermic that you mentioned earlier. It's called, some of them have obstruction. For those ones, they will just have epididymal aspiration, percutaneous epididymal aspiration, PESA. For people that are truly azoospermic, that are non-obstructive azoospermia, that means that there is no blockage, it's just that their testis is not functioning well, they need to actually go into the testis to get spermatozoa for intracytoplasmic sperm injection. And that will be done either TESE, which is testicular sperm extraction, or TESA, testicular sperm aspiration. TESE can also be micro-TESE or onco-TESE. These are all, I'm sure.
Thank you so much,
Thank
Doctor.
you very much, Doctor.
Yes.
Each time we have a medical doctor on this program, it's like, the conversation should not end, because every subject is interesting. But I hope, our viewers will also have found all of this very interesting.
Thank you
very much.
Thank you for your time.
You're welcome.
Thank you.